Thank you for joining us for another episode of the Deals for Dentists podcast. Today, we are joined by Dr. Jonathan Greenburg, who is the CEO and founder of Sleep Certified. So thanks so much for joining us.
Thanks for having me here.
And you can go to dealsfordentist.com and you can find their promo offer, which is pretty much get started today for $0. They take the guesswork out of implementing sleep treatment into your practice, and they removed the barriers for a successful dental sleep program. So Dr. Greenburg, tell me all about you and Sleep Certified and how you help dentists.
Well, I think the biggest question a lot of people ask is, why sleep and why now? It's, most of my colleagues have looked at sleep. Some have tried it. A lot who have tried it have stopped doing it. And so, I kind of looked at that and said, how can we help others? To give everybody a little background about myself, started out even pre-dental school. My undergraduate degree was in biomedical engineering out of Syracuse. And I was in their first graduating class with biomedical engineering. From there, I went on to NYU, and I needed good weather, so I flew out to Southern California, where I started my practice. Did dentistry and had a lot of fun, a lot of success. Back in those days in the 80s and 90s, we're dealing a lot with cosmetic dentistry. And then around 2000, 2001, fell into the world of snoring and sleep apnea. And that excited me a tremendous amount because it was new. And it was an area where we could have, instead of, in so many ways as dentists, we're related to being mechanics, where we're doing mechanical things for our patients. Physicians try to put us down and such, but here was a place where we would actually be treating the patient's health in a much bigger way. Literally preventing heart attacks, strokes, cancers, things like that, just having a massive impact. And so that intrigued me. So right around 2000, 2001, started getting very involved in treating snoring and sleep apnea. The other issue that I found very powerful was there was a huge number of people who had sleep apnea. 10% were being treated and diagnosed. I saw a big opportunity. So realistically, we know there's a ton of dentists out there, and most dentists are wonderful. They're fantastic. They treat their patients really well. And, as good as I was and as good as we all feel we are, I didn't feel that I was doing something truly unique for my patients. But with sleep apnea and snoring, I felt there was a niche there that I could make such a huge difference with. So by 2006, 2007, I stopped doing traditional dentistry, went to exclusively treating snoring and sleep apnea. I also saw that things hadn't changed in getting more people diagnosed or treated. It was still, at this point, I think we're about 40 to 50 million people with sleep apnea, still less than 10% treated. So you're talking about 4 million people treated, 36 million people not treated. That's a huge number. And when you understand that untreated sleep apnea, 4 times the risk of a stroke, 3 times the risk of a heart attack, type 2 diabetes, weight gain, or it's almost impossible to lose weight, GERD, Alzheimer's, 4 times the risk of cancer. And it is the root cause of so many of these illnesses. Car accidents, the list goes on and on. So that got me very excited. Now, the treatment for sleep apnea, there really are only 2 legitimate ways to treat sleep apnea. One is a CPAP machine, and CPAP machines work fantastic. They really work great. The problem is the compliance rate is only about 10 to 20%. So if 8, 9 out of 10 people that you give it to don't use it, it's not helping them at all. The good news is the other treatment method that's very successful is a dental mouthpiece. And so using a dental mouthpiece, the compliance rate is 80 to 90%. And from mild to moderate sleep apnea, the dental mouthpieces work equally as well as a CPAP machine. Now, I am saying that, but that's not me saying that. That's actually the CPAP manufacturers that are saying it. In fact, there are two CPAP manufacturers, ResMed and Respironics. I have on ResMed's letterhead where they cite statistics and research that says dental appliances and CPAP machine, there's no difference for mild to moderate sleep apnea. Okay, and it's got an 80 to 90% success rate. Now, I also got very involved in developing a new appliance. I said, that's fine for mild to moderate, but what about all our severe patients? And for our severe patients, we need something as well. So I designed an oral appliance that's unique and different from the others. It actually has a strap that goes in the rear to go over the palate, so the tongue can't get back there. What I call a seatbelt for the tongue. And we have used this very successfully on many, many severe patients. Now, all our patients, especially severe, but all of them, we do pre and post sleep studies. So we have the sleep studies on severes showing how successful they are. I've had a lot of fun over the years. Probably my most significant patient, largest as well as significant, is Shaquille O'Neal. Shaq has severe sleep apnea, would not wear a CPAP machine, and he wears my oral appliance and works very well for him. One of the fun things was a couple of years ago, Shaq and I were on Dr. Oz together, promoting and talking about snoring and sleep apnea. Now, and this really gets on why we're kind of talking today. I was frustrated, massively frustrated, with all these people who had sleep apnea and are not getting treated. I can only treat so many people. I'm in Los Angeles and I can still only treat just so many people. So I said, how do I change this system? How do I get these 40 million people? And by the way, it's not 40 million people with sleep apnea. There's 100 million people in the US who snore severely. Those other 60 million people who only snore, they need treatment too with an appliance. In fact, when you snore, not only you don't get REM sleep, but your bed partner doesn't get their REM sleep. It's what I call secondhand snoring. It's a term I coined about 6 years ago. And the truth is, which is really bizarre, your significant other can be sleeping next to you at night. And when you're snoring, you're impacting their REM sleep. They're not getting their REM sleep. There was a study program done by 60 Minutes. Now, this was about 6-7 years ago. And they took a young kid in his 20s and put him in a hotel setting. And he was going to sleep, they'd press a loud buzzer when he got into his REM sleep. Now, Leslie Stahl said, he's not even waking up. And the doctor said, but look, he's getting knocked out of his REM sleep. He's not having any REM sleep. After 5 days of no REM sleep, he became type 2 diabetic.
Wow.
Okay. And not only that, his leptin levels went down, his ghrelin levels went up. For those of you who are not familiar with leptin and ghrelin, those are the body's hormones that are your appetite suppressants. They keep you from overeating. And when you don't have those in normal proportions, the way they're supposed to be, you overeat, you crave carbohydrates, and your body metabolism literally cuts in half. So if you're not, in fact, University of Chicago medical school did a study. All they did was cut the sleep from 8 hours to 4 hours. And they did this on students. And within, I think it was 30 days, they were all gained, I think, 5 to 15 pounds because they were craving carbohydrates and their body metabolism slowed. My point being that your significant other that's sleeping next to you and you're the snorer, they are not getting their REM sleep either, which means they're actually gaining weight. So a wife could be married for her husband for 20 years sue for divorce, and they can sue the husband for weight gain because they stayed in the same bed with him, and they would win. So
that's such a good point, that the secondhand snoring, it's not just the actual patient, it's the bed partner as well.
yeah. Now
Now,
let's bring this home.
explain?
Yeah.
Yeah, go ahead.
Yeah, I'll come back to that in a second, but let's bring this home a little bit deeper. Harvard did a study, and they found that if you did not get your REM sleep the night before, you were 5 times more likely to get into a car accident. Okay.
Wow.
And if your wife's driving the kids to school or other places or on our errands, or the husband or any of us, this stuff's serious. And the reason I go through this, and the reason it's easy for me to be so passionate about what we do here, is because this impacts people's lives in a massive way. And we as dentists are in the perfect place to be able to treat these patients. A third of a dental practice patients, active patients, have a severe snoring and sleep apnea issue. So if you have an active practice of 1,000 patients, 330 of your patients have a snoring and sleep apnea issue that you can be helping and treating and making a huge difference in their life. And so that got me excited. It's one of the reasons why I looked at why the system currently was broken. Why are 90% untreated? And when I asked myself that question, I looked at the process. Currently, if you want to get treated, you have to take time off of work, go see your physician. They then refer you to a sleep physician who sends you to an overnight sleep lab that they kind of own. That's how they make their money. And you get a lousy sleep, 23 wires hooked up to you from head to toe. You then go home. You then have to take work off again to go to the sleep physician's office, where they tell you you have sleep apnea, you need a CPAP machine. They write you a prescription for a CPAP machine. You call a company, a durable medical equipment company, what we call DME, like Apria, to get a CPAP machine. Typically now they ship it to you. They do a Zoom call, put you on auto ship for hoses and masks, which is how they make their money, and you never hear from them again. And you want to know why 90% are unsuccessful. So I said, and I would have patients come into my office. Honestly, they didn't care about heart attacks, strokes, diabetes, none of that. They just said, Doc, if you can stop my snoring, get me back in bed with my wife or my husband, you're my hero. Like, you're there. That you're the man, or you're the woman. And so I said, I realized snoring was the key. So to get access to this 100 million people and the 40 million sleep apnea people, I invented a mouthpiece specifically for snoring only. And I created a company called Zyppah, which is Happy Z spelled backwards. You can go to zyppah.com, ZYPPAH.com. And it's a snoring mouthpiece that sells for $99, so it's less than $100. People can order it online and get their snoring handled. To me, that was the bait, the hook, to start educating people and to get them to realize snoring is something really serious. It's not something to laugh at. I mean, I think most of us watching this podcast can think about back to Thanksgiving, not COVID, but when we had lots of people over for Thanksgiving, and Uncle Joe ate a little too much turkey and stuffing. And Uncle Joe went on the sofa, the couch, and he fell asleep, and he is snoring like a banshee. And everybody's kind of there, and they're laughing and pointing their finger, and it's a lot of fun and a big joke. Now, 4 months later, Uncle Joe has a massive heart attack and dies because of his untreated sleep apnea. And all the people at Thanksgiving could have saved his life by making sure he went to his dentist or his physician and got treated for sleep apnea and his snoring. So this is what's going on. So with Zyppah, we spent over $20 million in advertising. Do you know another company in dentistry that has spent $20 million in advertising? Okay. I mean, we were on Sirius nonstop. We actually did ads on radio ads on Super Bowl. We had ads, billboards in Times Square. We were on TV ads, ESPN. We donated $50,000 to Boomer Esiason during Super Bowl week. We had sponsored Indy race car. So we spent all this money basically. And for anybody who's heard our ZPA ads, you either loved them or hated them. Jimmy, they were basically Jimmy, and Jimmy's this kind of Goomba from New Jersey there. And Jimmy could say things that I couldn't. So Jimmy would say, have some respect for that person sleeping next to you, and he'd do it in that Italian accent. And, it was incredibly powerful. To give you an idea how powerful it was, we were getting 20,000 unique visitors to our website every single week.
Wow.
It's a big number, huh? Okay. So 20,000 unique visitors every single week. Huge. It's 1 million people a year. Now, the interesting part of that, half of those, or 10,000 people a week, those people had sleep apnea. I couldn't sell them a sleeping appliance. I couldn't sell them a ZPA mouthpiece, but I could refer them to a sleep apnea dentist, a dentist who was really good in treating sleep apnea. Unfortunately, at the time, and this was about 3-4 years ago, there were very few dentists who treated sleep apnea. Today, there's still a very few dentists who treat sleep apnea. There's about 150 to 200,000 dentists. There are less than, I would say, 1,500 dentists, or 1% of 150,000, who really, I would say, are extremely good at treating sleep apnea. And when I say treating really good, to me, that means treating, a minimum of 10 patients a month. It's like if somebody treated 3 or 4 orthodontic patients a month, would you say they're as good as an orthodontist? Okay, probably not. Or 3 or 4 root canals a month, are they as good as your endodontist? So if I'm going to be referring patients, I needed to have that dentist to be really good. And unfortunately, even the diplomats, most diplomats with the AADSM, which is the American Academy of Dental Sleep Medicine, only treat 3 or 4 patients a month. So I said I needed a way to be able to get dentists trained. If I'm going to refer patients to dentists, I need a way for those dentists to get trained, and get trained well, and get trained at a high level. And we also needed to be completely transparent to consumers, because if we refer a patient to a dentist and that consumer goes to that dentist and has an awful experience, and that dentist isn't very competent in that area, sleep apnea, then they're going to go on to Facebook and the internet and write all kinds of bad reviews about us as a company, as a referral company. So what we did is we created a company called Sleep Certified. And the reason Sleep Certified is exactly this reason. We needed to be completely transparent to our consumers who we would be referring to dental offices. And how we would, how the certification goes, there's 9 levels of certification, and it's based on 4 criteria. How many patients do you see every month to treat? What is your education? Okay. What kind of courses have you taken? How many courses have you taken? How many 5-star reviews have you gotten, and do you get every single month? So if you got 5-star reviews 6 months ago and none in the last 3 months, there's a problem there. And what's your average of all your reviews? And that was important. So that's how we go from level 1 to level 9. And that's how we did Sleep Certified. The other thing that we did is we created online education. Because how many times do we as dentists go to a course, we take our staff, we're all excited, we get back, and a month later, that key staff person quits, or they move, okay, which is basically they're no longer working for you. And that person who was running all of that, whether it was Invisalign or Cerac or sleep apnea treatment, they're suddenly gone. So this way, and we did this even before COVID and the pandemic. We said, let's make all the courses online. And we did. We've got about 20 courses now. They're all an hour in length. They're broken up into chapters. And there's a couple of questions after each chapter. So as a dentist, you want certain team members, staff members to take a course, but you don't want them watching the course on TV while they're making dinner for the family and not absorbing any of it. So every 5 to 10 minutes, there's a break, and whoever's taking the course has to answer a couple of questions to ensure that they have the material, and then they can go on to the next chapter. And they can't go on to the next chapter until they answer the questions correctly. And so we do that so everybody can do that. We also created a forum like Dental Town just for sleep apnea. Also, before the pandemic, I have my Snore Experts treatment centers. There are 5 treatment centers. All the forms, and there's probably close to 100 forms that we use in the treatment center, from the informed consents and things for insurance, billing and patients and all these different things, are all on the website. They're all downloadable. So everything we teach in Sleep Certified has been vetted and tested in my treatment centers. It's stuff we do. And in my treatment centers, we do everything in one place. We've got sleep test units. We have 50 home sleep test units, 50. So it's a lot of sleep test units. We do all appliances. We also deliver CPAP machines. We also do laser. Okay. So we do everything all in our one location. So when we talk about something in our on our courses, on our website, we look at the Sleep Certified to be kind of this universal kind of Switzerland. It's this library that dentists can come to especially when they're first getting started, to find out what's going on. We have the Zipon mouthpiece, but honestly, with Sleep Certified, we don't care what appliance you use. You can use a TAP, a Somnomed, a Herbst, whatever you're comfortable with, we want you to use. And there's a lot of great appliances out there. We have a course given by Dr. Rob Weiss, where he talks about all the different appliances, because we want you to know all of that. So we've got the online program, and we made it very reasonable, I think. We made the membership for that at $299 a month. Okay. And with that membership, you get access to all the courses. You can quit in a month. People have said to us, what happens if I take all the courses in a month? I don't need you anymore. I'll quit. And I go, fine. If our value isn't sufficient to make you stay, then you should quit. We want to earn our keep every single day with Sleep Certified. So adding additional courses, all different things. Also discounts for dentists as they're doing and treating sleep apnea. And so that's how Sleep Certified was all set up. Now, here comes the pandemic. And we looked at that because the other part of Sleep Certified is we had advanced training courses. The advanced training courses, we would teach you during a 6-month period how to be an expert, basically how to be a specialist. It was specialist training in sleep apnea. You'd come out to our treatment centers in Los Angeles. You would get over-the-shoulder training. You would have your specific consultant. And within 6 months, and we handpicked those practices, you would be an expert. And when, we started getting all that going, and then the pandemic hit. And that was huge. I mean, for all our fellow colleagues, the last 15, 18 months has been devastating. One of the questions you asked me is who is really this tailored to? And I would say, your DSOs, they're smart, they're good business people, they're jumping into sleep. But the solo practitioner, they need us. The solo practitioner needs us more than anyone. And for the solo practitioners who've made it through COVID, a lot of us are all very, very busy right now. It was that pent up demand. That's the good news. The bad news, that pent-up demand is going to be gone in 60 to 90 days.
Yeah.
And what do you do now? The DSOs, with their big marketing budgets and everything else, are competing in a huge, huge way. And they're not going to ignore sleep. It's the next big thing. You know, in the 80s, we had cosmetic dentistry. 90s, we had implants. We had Cirec and Invisalign, and that took us through the 90s and 2000s. And now sleep is that next big wave. Everybody who's a dentist is going to be treating sleep in their practice. Question is not, are you going to be treating sleep? It's when are you going to start? Mm-hmm. And the sooner dentists start to bring it into their practices, the further ahead of the curve they're going to be there to capture more of that portion for their practice. So we said, what can we do to remove the barriers? If we're going to be really honest and transparent, and that's what that's the more people you know me and such, that's what we're about. Most dentists who have gone into sleep have gotten out. Too frustrating. The insurance companies were too challenging. What's legal? What's not? Your physicians are telling you shouldn't be doing this. Sleep testing, you're not allowed to diagnose sleep tests and sleep apnea. All these different things that you're being thrown at you, and then the insurance companies just make it so challenging. So we said, we get it. We need to create a program that's going to remove all those barriers. And we called it Sleep Certified 360. Why 360? Obviously, because everything A to Z. And we designed it specifically for dentists who have not treated sleep currently. So it's for those offices who have never treated sleep or who took a couple of courses, weekend courses, tried it, couldn't get paid, too much trouble, and they backed off and went away from it. That's who we designed this for. So in a nutshell, what we're teaching when somebody, a dental office, signs up for Sleep Certified 360, they go ahead and they screen their patients. Now, remember I said a third of your active patients have sleep apnea and a severe snoring problem. Just because it's not sleep apnea doesn't mean you don't treat them. Snoring is as much a wrecker for a relationship and somebody's health as anything else. Just because insurance won't pay for snoring doesn't mean you don't treat it. Insurances don't pay for porcelain veneers or teeth whitening either. And a lot of orthodontics they don't pay for, and they don't pay for a lot of implants because you beat out your coverage with your first implant. But we do them anyway, don't we? So we have to get off of this sleep apnea mindset that if it's not covered by insurance, we shouldn't be treating it. So in Sleep Certified, we teach you, hey, you can use care credit, you can charge the patient. That's not a problem. Now, for a lot of patients, though, insurance is great, but you had to be in network. Out of network, the deductibles are $3,000, $5,000, $10,000. That's not gonna, people have great insurance, but because the deductible for out of network is so large, there's no coverage. But in network, there is coverage. So what we did is we created this program, this Sleep Certified 360 program for those patients for in network. And what we do is you just screen your patients and you put them into this dashboard. And basically it's kind of like you've got your patient and they go, yeah, doc, this is interesting. Dr. Block, can you tell me more? And so you go and you say, oh, you have your front office person go, look, we're working with Sleep Certified 360. We're going to connect you with them. And they're going to take it from here because you're going to need to speak with a physician. You're going to need to get a sleep test, and they're going to get all that handled for you. So the patient calls them up. We did, through us and the group we're with, we do a telemedicine visit. So with a physician. So now you got the telemedicine visit with a physician. That's handled. Next, they're going to ship you out a home sleep test unit. And they're going to pre-authorize your insurance for it, ship it out to you. You'll do the sleep test. The patient will do the sleep test and then send it back. They send back the sleep test unit. It's going to be read and diagnosed by a board certified sleep physician. Again, all clear, legal, just the way it needs to be. And then there's another visit with the physician on another Zoom telemedicine visit where they review the treatment options. And obviously, in almost all cases, patients want the oral appliance. We then pre-authorize with the patient's insurance. We collect any copays from the patient. We bill the insurance. So your office doesn't need to collect any money from the patient. You then take them, you get the prescription from us. You take the impressions, which as dentists, we do really well. Do an exam, as dentists, we do that really well. And then we do the delivery a few weeks later with the mouthpiece. And with that mouthpiece, again, it's like doing a bruxism appliance, an Invisalign appliance, not very challenging, a few adjustment visits after that. And typically about 30 to 60 days after the delivery, Sleep Certified will send that office a check for $1,800. So your office, we do all the work and you get that check for $1,800. Now, it's not as much as if you went and the patient didn't have insurance and you just charge them as if they're out of network or cash pay. You can charge them $3,000, $4,000, $5,000. $4,000 is the average throughout the country. And you'll make more, but then you've got to handle getting the sleep test and such. And we'll show you how to do that. So as part of Sleep Certified, we have all the courses that will teach you how to do that as well if you want and you're interested. But if you're not, this is another great way to go. Now, and that's why we call it the Sleep Certified 360 program. I mean, if you think about the numbers, say you have 2,000 active patients in your practice, and we just go a third. So you're talking about 2,000, so that would be 600 patients, right? Okay, would be a third. But let's say, that's how many you could treat is 600. But let's see, you only treat 200 patients, a third of that, okay? A third of that, 200 times $1,800 a piece. That's a lot of money, isn't it? It's $360,000. And the net of that is 75% because you already have your staff. You're paying the lab fee, which is about $400. So $400 out of the $1,800, you're about 75%. So basically, you can easily net another $150,000 to $200,000 in your practice by just treating 25% of your patients who have sleep apnea. Not bad, huh?
And these patients, they're, let's say you have 1,000 patients and there's 30%, they're there. These patients are there. They just haven't been questioned or screened properly. Is that correct?
It's no different than you have a patient that comes in that's missing tooth number 19. And you don't tell them they could have an implant or a bridge. Or patient comes in with that is not even as bad as patient comes in with advanced periodontitis, 7, 10, 11 millimeter pockets, and you don't tell them that they have gum disease, that they've got advanced perio disease, okay? Because your patient who has sleep apnea, they can go home and have a heart attack or a stroke next week, next month. Now, with our advanced training courses, there was a dentist that was there with his team. And I didn't know this until a few months later. They were in my Pasadena office on one morning, and we were doing a webinar, and he was on it. And he said, what was so amazing is just that morning, unsolicited on normal patients, he had like 4 people come up to him and tell him that the treatment that we had done for them absolutely changed their life. It was either they had lost 80 or 100 pounds that they've been trying to lose for the last 20 years. They're no longer type 2 diabetic. They're off their type 2 diabetes. They're metformin. They're not taking medication anymore. Their blood pressure is now normal. They were on blood pressure medicine for 10 years. Now they're back in bed with their wife or their husband. He said, in my career, I maybe had 2 patients where it was that kind of a change for them. And here in Dr. Greenberg's office, one morning, I had 4 patients tell me this. He goes, I am so ready to, get there. And now this dentist, he is now doing sleep apnea exclusively.
Mhm.
So, and that was a few years ago, and now he's transitioned into that. So, as our tagline with Sleep Certified is, don't just be their dentist, be their hero. Because
Mhm.
when you treat sleep apnea, you really are being their hero. You're being that doctor that their physician has let them go by. But their physician knows they're not going to wear a CPAP machine, so they didn't even tell them about it. A cardiologist, 75% of a cardiologist patients have sleep apnea.
Mhm.
And they don't send any of them for sleep testing. It's malpractice. Okay? We as dentists can fill that role because these patients are in our office. They're coming for their cleanings regularly. We see them. If you have a patient who snores loudly, there's a 40% chance they have sleep apnea.
Mhm.
Okay? If they snore loudly and they have high blood pressure, there's an 85% chance they have sleep apnea. If they snore loudly, have high blood pressure, and are obese, it's a 90% chance they have sleep apnea. If they have type 2 diabetes as well, it's a 99.999% chance they have sleep apnea. But don't think your thin patients don't have sleep apnea. Okay? Snoring is a partial blockage of your airway because the tongue is falling back. Sleep apnea is a complete blockage. Why don't we snore when we're younger? Because we've got better muscle tone, but as we get older, we lose muscle tone. Our tongue's a muscle. So as we get older, we start to snore. And people say, I only snore when I drink alcohol. It's because alcohol is a muscle relaxant.
Mhm.
That's where you'll be in 5 to 10 years. Okay? So really, snoring and sleep apnea is about a big tongue and a small mouth. But if somebody's overweight and obese, they're in trouble regardless. So if you want to know, as a dentist, who has snoring and sleep apnea issues, here's the giveaway. Any single patient that you take x-rays on and they gag, or with any patient you're doing a dental procedure on and they're gagging, I will bet 95% of the time they have a snoring or sleep apnea issue because they have a big tongue and a small mouth.
Mhm.
That's why we gag.
Mhm.
It's not rocket science. There's no room for the tongue. You put something else in the tongue, the patient gags. Every time your assistant takes an x-ray or you're treating that patient and you need that extra assistant with strong arms to keep that tongue out of the way, that's your snoring and sleep apnea patient right there. Have that conversation.
Mhm.
Sleep apnea, it's the easiest procedure a dentist can do. Especially as baby boomers, as we're getting older, our eyes are going, our back's going. Full day of crown preps, implants, surgery. I mean, we're exhausted at the end of the day. Sleep apnea is the most fun you ever have because it's like ortho and Invisalign. Your staff's really doing most of the treatment. Your staff's taking the impressions. Your staff is doing the deliveries. Your staff is doing the adjustments. You are, speaking with the patient. You're diagnosing. You're doing the exam. You're going through, and you're working and overseeing your staff. It is one of the most fun things you can do as a dentist. And then the appreciation you get from your patients is equally as fun. Not even talking about, the money and, the financial aspect.
And with your 360 program, like you were saying, there's a lot of barriers that dentists have to go through. There's a lot of barriers that patients have to go through. We are trying to remove these barriers so we can help these patients. Personally, for my office, I don't want to deal with the medical billing and all the coding and all the reimbursement. So it sounds like you're taking those barriers away, so it's an easier transition for us to treat these patients.
That was the whole goal. I was frustrated hearing all of, my dental colleagues talking about, oh, I want to do sleep. I tried it. I took some courses. I couldn't get paid, or it was too difficult. It was too challenging. And that's why we created the 360 program. We said, it's happening. We need to find a way to remove these barriers so that it's really easy. It's a no-brainer for the dentist. Now, one of the fun things is when a dentist starts, when they sign up for the 360 program, they are going to get their own individual consultant. I find us as dentists, one of the big hurdles we have are the what ifs.
Yes.
Okay. I don't want to do this because what if this happens? What if that happens? We're trying to anticipate. We're trying to look like in chess, 8 moves down. And it becomes this great hindrance, this block that ever keeps us from getting started. So when somebody signs up with Sleep Certified, they immediately will get their own personal Sleep Certified consultant. Okay. And they will speak to that person every week. So once a week, they will have a scheduled appointment time to talk with them. In addition, 24/7, they can go on the forum and get questions answered. So as a dentist, you're never out there by yourself. You're never practicing alone. All the what ifs. Patient comes in and they suddenly have a TMJ issue. They've got pain on the right side of their jaw. What do I do? Oh my God, what do I do now? And it's a simple solution, and if you're not sure, just call your your person at Sleep Certified. And if they don't have the answer, they'll speak to me or one of our other dentists. And, in that situation, typically in 95% of the cases, and it's in our courses, but 95% of the cases, the appliance is high on the right side.
Mm-hmm.
The bite's too high. Reduce that side. You go ahead. So either one of two things happen. You advance them too quickly, or the bite is high on the right side. And 95% of the cases, it's high on the right side. When basically when the bite comes down, if they're hitting on that molar first, that second molar first, you're going to create pain, muscle spasm. They're going to, all these different things. All you have to do is reduce the bite on the right side. Pain goes away. Boom, gone. The what if is not an issue. The wonderful thing about treating sleep apnea is I've treated thousands of patients at this point. You can't get into the same kind of trouble that you can get into when you're doing an extraction, an implant, a root canal. There are certain key things, and we go through them in the courses, and you're going to have, again, your consultant that you're going to be working with. But it's so much easier than almost ortho you can get into more trouble with. You can make the teeth more crooked. You could do bite changes, all these kinds of things. And you're going to hear some of these negative things. You're going to hear, oh, have a patient, their jaw now is forward, or they have a permanent open bite. Okay. So that's why you take the courses, so you don't have those issues. There's always anything, if you look at implants, all the things that could happen, okay, or an extraction, all the things that can happen, but you still do them. You do root canals, you do crowns. I can give you a laundry list of all the things that can happen until you start doing them and you go, oh, piece of cake. So that's why we're there. We are here to hold your hand. We're here to hold your hand so that you don't have to worry about the what ifs. We're not abandoning you. We're going to make sure that you get past it. That's our goal. And our goal with Sleep Certified is to be able to bring you on as you're first starting out with sleep, all the way to you being a sleep specialist. So when you want to treat the most advanced cases of sleep apnea, including you want to put a patient on a CPAP or an APAP machine, we'll teach you how to do that and get paid for it. Okay. So whatever it is in sleep, whether you're just getting started or you want to be at the very high advanced levels, the level 9s, and do this as a specialty, we're there for you. If you want to, you're in your 50s or 60s and wanting to transition in the next 3 to 7 years to retirement, our program will, if you follow our program by incorporating sleep into your practice now, we will show you how to get significantly more money when you sell your practice and probably take home net as much working 1 or 2 days a week as you did when you're working 4 or 5. So we've got a great program for that as well. So, there's so much that's here, but none of it happens unless you take the first step.
Mm-hmm.
Eric, you asked me a question when we spoke before. Who's the perfect practice? When do I know the perfect practice has come on board? And it's really simple. They're excited to come on board and they do what we tell them to do them. Well, they do what we tell them. Okay. When they try to recreate the wheel on their own, or when they want to just dip their foot in and go, oh, well, let me see if this really works or not. We typically don't get fantastic results, but when they go, you know what? I got to do this. I know it's here. I want to do it. I trust you guys. We're going to teach you then how to do it, but you got to do what we tell you. If you're not ready to do it, if you're not worried, if you're not ready to deal with the what ifs and let us teach you and walk you through that and hold your hand through it, then your practice is not the right practice. Don't waste your time. You got to really want it. And if you want it, we're here to help you through it.
I think you nailed some of the biggest reasons why I hadn't gotten involved were the barriers that we already discussed, the medical reimbursement, the sleep study, all of that. But then the what ifs. What if, and let's say I'm a solo practitioner, out somewhere rural and there's, not another dentist for miles. What if it doesn't go right, or I need help? But you're offering that kind of that consulting backup and the forums, and you're there to help guide that dentist with the questions of what if. So I think those are, for me, were the biggest barriers, is the medical aspect of it, and then the what ifs, because this is something new I'm adding to my practice.
One of the things that I think is important for, dentists who are listening, watching to this podcast, is that anything we teach them, anything we talk about here is, it's stuff that we do in our own offices. So this is not, I'm not this lecturer on the circuit full time. This is something I'm wet fingered, 100% in sleep. So whatever you as a dentist is going to go through, I've been through. I'm not sure how many dentists out there have treated more patients than I have. There's a bunch of us where it's a very small group. But when you've done that, when you've treated thousands of patients, you've pretty much seen it all. There's not a patient that's going to walk through the door that's going to surprise you, that's going to show you something that you haven't seen before. And that is what I share with all of our sleep certified members. So when you become a member of Sleep Certified and Sleep Certified 360, this is the information we're going to be giving you. It's not, out of some kind of textbook or something. This is live, what's working and not working in our offices every day.
I can tell you're passionate about this, because, you're not just saving teeth or aligning teeth, but you're saving lives.
One of the things, Eric, is the way we set up Sleep Certified 360 is we don't make a penny unless the dentist makes money. It's because we're making a percentage of the dentist of what the dentist makes. So if the dentist doesn't treat any patients, we don't make anything. We've wasted all our time. So we are motivated for the dentist that comes on board to be really successful, because that's the only way we make money. Mm-hmm. Okay. Now, when somebody joins Sleep Certified 360, we need them to be a member of regular Sleep Certified at all, where there is that 290, I think it's 299 per month, that membership fee. So that's $300 a month. If you think about, if you treat one patient a month and you get $1,800, it certainly more than covers the $300 a month membership fee. But for the members of your podcast, the people who have listened to this and have come on board with it, what we're doing is we are waiving the first 3 months of that $299 membership fee. So for Deals for Dentists, we are Sleep Certified's waiving that $299 per month fee. And that way, as a dentist, you are never coming out of pocket. At the end of that 3 months, I can guarantee you, you're either all in, excited, doing this, and that $299 a month is well past ever being an issue, or you go, this just isn't for me. I'm, thank you for the attempt, but not for me. I'm not doing it anymore. And you're going to stop and cancel, and it's never cost you a dime.
Yep.
So that's why we're doing it for 3 months, for 90 days. So, any dentist who wants to try it, they're not coming out of pocket at all. And, it's our way of, really doing something special for your dentists and your group that, are, love your podcasts, and you do a great job with your podcasts, and, getting all kinds of, great information out with, it's just amazing the array of, people you've interviewed and stuff you've done.
Oh, thank you so much. Well, that's, I think that's such a great way to have a dentist get started with this, waiving that first 3 months, and this could reinvigorate your practice, your staff, for sure, your patients, by adding this to your practice. So again, Dr. Jonathan Greenburg, CEO and founder of Sleep Certified, thank you so much for joining us today. That was an extremely informative episode today. Thanks again.